can stretch in one single direction or uniform direction. That means uniform. So single direction, the cell will be migrate to the parallel. If you stretch this direction, it will change to migrate to this direction. If you use uniform force, the cell will be randomly migrate there. So otherwise, we can use the direction, the force direction, to control the cell migration.
Even suctional choline during rapid sequence intubation of the trachea. So rapid sequence intubation is done emergently in usually the emergency department or out of hospital, and it's done to decrease the risk of aspiration. And so these are the two main drugs used. So I was curious if rocuronium could be used as a first-line treatment, because succinylcholine choline is the main first-line treatment right now. And I found that from my research that if you use rocuronium at a dose of 1.2 milligrams per kilogram or greater, then it is comparable to succinylcholine choline, and there's a non-statistical difference between the two drugs. I think this is important because as a nurse, we administer these medications, so I think it's important to know their side effects and how they affect the patient, and if we're using the correct medication for the job. So looking at the safety profile between these two drugs, I thought was very important.
Hi, my name's Sage. I'm a student at Emmanuel College, student of nursing. My project was on maternal and infant bonding and skin-to-skin and swaddled holding. I'm interested in labor and delivery and neonatal nursing, and my PICO question was, in postpartum women, what is the effect of skin-to-skin holding in comparison to swaddle holding on the incidence of mother-infant bonding, postpartum depression and anxiety? I thought this question because postpartum anxiety and depression affects 1 in 7 newly mothers in the first year of childbirth, which is a lot. And in a study, there was half of the women reported impaired bonding, and through multiple studies of skin to skin, there's a lot of positive benefits through skin to skin, such as early breastfeeding. There's also stable vital signs that were noted, and also even at the chemical level, oxytocin's released, which is the bonding hormone. And looking at swaddling, although it helps babies in certain circumstances, however, you can't replace skin to skin with swaddle holding.
Do myelodysplastic syndrome. My grandfather had it, so I wanted to learn more about MDS. So I focused on different types of treatments, supportive treatment versus like a targeted treatment. So supportive would be focusing more on the patient's like symptoms and improving quality of life, where the targeted would be targeting the cancer and cancer cells, which can be very demanding on the patient. And through my research, I found a lot of older information, so we do need updated stuff. But what I did find throughout all of it was that patients' quality of life and like their opinions and feelings is not always focused on or highlighted. It's not normally a conversation between the care team and the patient, because a lot of patients develop this later on in life, so people might not want the very aggressive and really demanding, expensive treatments. But we did focus on my research on transfusion independence and the importance of decreasing the need for blood transfusions that are required for any type of MDS treatment you do, supported or targeted, because an increased amount of transfusions puts a lot of burden on the body, and the iron buildup from the blood being inside of you and the body not being able to process the extra amounts ends up damaging target organs and end up shutting down organs like your brain, your heart, and that also is very bad for the body. And so it's something that needs to be considered more, and it's not a fallback plan anymore, because that ends up shortening patients' life rather than the MDS. So. about music therapy and using that as an added treatment for nausea relief in chemotherapy. So I really looked at nausea as kind of a symptom and kind of really dug that, kind of tore it apart. You know, nausea, it really affects people's quality of life, their adherence to treatment, malnutrition, dehydration. There's so many things that nausea directly relates to. And so I was trying to come up with different ideas that could be utilized that aren't going to be pharmacological interventions. And music therapy is a really great tool that can be used on top of other interventions. And as a way to reduce nausea. And so I looked at many different trials, and there are a lot of studies that show patient preferences are really impactful on reducing nausea. And yeah, I think that using more of a holistic care model, using different interventions would be really effective.
Awesome.
My name is Caitlin Whitecross. I just got my master's degree from Emmanuel College. Previously, I worked at Beth Israel Deaconess Medical Center in Boston, and currently I just transitioned to a clinical nurse specialist at Beth Israel Deaconess in Needham, Massachusetts. So my research was actually with a focus of nurse residency programs and the importance of getting your new graduate to attend them, and the support and necessity of nursing leadership and management to support that attendance. Because evidence-based practice has showed us that nurse residency programs help us retain our nurses. And with, as we heard today, the global shortage of nurses all over the world, it's important to retain these nurses because we spend thousands upon thousands training them. On average, at Beth Israel, I was roughly quoted by one of our senior staff that it's within the $50,000 to $70,000 range to onboard new nurses. So it's crucial to get them to attend their residency program. And we did a survey to identify some of the problems that nurse residents and directors were encountering. And then we developed interventions for the nursing directors and leadership roles, as well as for that oncoming new graduate to help get them to attend their programs. We didn't get to implement the surveys because it was done in a semester's course for graduate school, but we hope to do that further and to see if these interventions help with our improvement in attendance.
Hi, so me and my group's research look at comparing birth outcomes, specifically C-sections and preterm births, when you look at a collaborative care model with midwife involvement in obstetric care versus a standard obstetric care model without midwife involvement. And what we're able to see is when it comes to midwife involvement, we do see a significant decrease in preterm births and cesarean sections.
So I did a project called Empowering Nurses to Educate Patients Following Spinal Cord Injury. It's a pressure injury intervention. And essentially at Spalding Rehab in Charlestown, they were having an uptick in pressure injuries on their spinal cord injury floor. So what we did was we investigated what was happening, and essentially they were finding that a big problem was patients declining to be repositioned overnight. So we investigated how we can kind of combat that, including some of the things that we can say to these patients when they don't want to be repositioned overnight, and some alternatives and solutions and compromises we can make. Ultimately, we did find some other multifaceted issues that were contributing to the problem and determined that there was work that needed to be done before we could work on a solution. So some of the things that we found were that more education needs to be done up the ladder, including with the medical team as well as case management and other multidisciplinary focus groups. But we're hoping that if we get more time to work on this, we'll be able to get everybody on one page and get these patients moving overnight.
Hi, so my research looked at infants who are born addicted to opioids and other illicit substances while they were in utero, and how feeding strategies can impact their healing and their overall outcome. And what I found was that the infants who were breastfed versus the formula-fed infants were better off pharmacologically. They needed less treatment and less supportive care than the infants who were formula-fed, and that was evidenced using the Finnegan scores, which is something that nurses use to score infants to find out if they need the pharmacological treatment, which looks at things like fever, sweating, crying, seizures, and other physical symptoms. And so obviously the feeding strategies are dependent on situation, but overall breastfeeding is safe and effective for infants with withdrawal symptoms.